And good morning. Welcome to a special edition of Main and Center Coronavirus, a local view. I'm Dan Fischer, and the purpose of today's program is to talk about and answer questions that you may have about the COVID-19 virus in Batavia and Genesee County. Now, so far, we have no confirmed cases of coronavirus in the county, but most experts agree that's just a matter of time. And speaking of experts, we're pleased to have assembled a panel of local experts. We have two representatives from the Genesee County Department of Health. One is Mary Hamilton. She is a public health educator with the Genesee Orleans Departments of Health. Kristine Voos, who's an epidemiology coordinator, and we'll ask her to explain just what that is. And we're also very pleased to have with us Mr. Dan Ireland. He is president of United Memorial Medical Center, an affiliate of Rochester Regional Health. Mary, let's begin with you, or Kristine, with the numbers as they exist this morning. We have no confirmed cases, but we do have some folks under quarantine.
That is correct. So we do not have any confirmed cases in Genesee County. We do have 5 people in Genesee County and 2 people in Orleans County who are under precautionary quarantine.
And what does that mean?
So basically, we're asking them to stay in their house. They have not exhibited symptoms or have not been diagnosed with COVID-19.
So what causes them to be asked to quarantine?
Good question. So with that is because they've traveled to a country where COVID-19 is having, widespread transmission. So per that is the CDC a level 3 country that is ever changing, as you can imagine, with this fluid situation. So travelers are encouraged that they look at the CDC website, see what is listed as a level 3 country. And also a level 2 country is a lesser of concern, but still making sure that if you've traveled to a level 2, that you're self-monitoring if you would to have any symptoms of COVID-19, like a cough, shortness of breath, and a fever. So precautionary, they've traveled to a level 3 country. They are going to be under, isolation in their homes for 14 days, but then the mandatory quarantine, which we have 2 people in Orleans County who are on mandatory quarantine, means that they have been in contact with a COVID positive person.
And
they may not have any, yes, we know that. They may have symptoms, they may not, but at that point, they'd go into that mandatory quarantine and they would receive testing.
When you say mandatory quarantine, where's the teeth in that?
The teeth in that. So that's a good question as well. Anyone who is under a precautionary quarantine or a mandatory quarantine will be in contact with our departments. If they're Genesee or Orleans County residents, they'll be interfacing with our public health nurses or our epi team, and that requires that we're monitoring that they're actually home, that any symptoms were, what is their health status? Do they have a fever? We're recording temperatures on a daily basis. And when it comes to that mandatory quarantine piece, we're checking on them twice a day. So we have to have eyes on them in their physical location, and then probably, follow up through an email, a phone call, something of that nature.
So with no confirmed cases of the COVID-19 virus here in Genesee or Orleans counties, why then, Dan Ireland, a state of emergency?
Well, I think as I understand it, the county and state of emergencies were called because the increasing number of cases that are happening throughout the known ability for community-based transmission, and I believe it's something we've been talking a lot about is our efforts to bend the curve on the actual prevalence of the disease.
We hear this term flattening the curve.
Yes,
What does that mean?
That's generally what it means is that the healthcare system, not just the hospitals, but all of us, the county health department, the doctor's offices, have so much capacity for normal sickness throughout the year. When you have a pandemic illness or a illness like COVID-19 that is coming about, you see sharp spikes in that, and that creates demand and strain on the healthcare system as a whole. Flattening the curve is you try to curb the amount of instances of that illness so that your normal and even somewhat escalated functions can help accommodate patient care during that time, and you stretch it out and eventually eliminate transmission, which ultimately results in the community restoring to normal. The state of emergency, as I interpret it, as I understand it, helps officials in the government as well as healthcare providers and others take the appropriate steps that are a little bit more out of the ordinary at times, such as what our hospitals have done. On the news, you present the police departments have done and other agencies have done to be able to help with that flattening of the curve.
It gives you, as I understand it, it gives local governments an easier access to higher levels of governments for financial resources or other types of resources. But it is, and I'll direct this to the PIOs in the room, it's kind of a scary term.
It can be. I think everyone, the community is in this together. We need to keep a level head. We need to get the information out there that's accurate. Opportunities like this are perfect for that. And I think across the counties in Western New York and beyond that have been doing a good job of working together, local partners, public health, hospitals, emergency management, first responders. It's getting that information out and not getting wrapped up in the panic that can ensue. Just listening to the guidance that's coming out is very important. Social distancing, as we know, is maybe going to be the term of the year already in 2020.
Kristine, define that for us.
So social distancing is keeping a greater proximity between people. Not engaging with
Don't
as many people.
sit in a small studio like this and we're 3 feet apart.
I know. It can, and this could change. We're doing this today. That is a consideration, but yes, trying to stay home as much as you can, canceling those plans that you have on the weekend with your going out in public spaces with your family, and making sure that you're doing other things that we should be doing already without COVID-19 in our faces, having proper hand hygiene, making sure that we're disinfecting high-touch surfaces, staying home when you're sick. COVID-19 is in everyone's faces, but there's a lot of other respiratory illnesses that are going on. We're still seeing widespread transmission of flu. We're still in the flu season. We're starting to warm up, and we're going to have allergies that people are going to be experiencing. So, I understand that people are concerned about COVID-19. We will see our first cases at some point, but just to be aware that there's guidelines in place when it comes to the testing for COVID-19. The state and the CDC have specific guidance as far as who is a good candidate that warrants testing. They have to have symptoms. They have to have, evidence of travel. And those guidances can change too. So if you are concerned that you've been exposed to COVID-19, calling your doctor ahead of time so they can do that screening, because I know people want to be screened for COVID-19, but again, we want to make sure that we're not burdening the healthcare system, that they do their jobs to their best of their abilities, and calling ahead of time and not showing up to urgent care or emergency room or a primary care provider office without first calling is of utmost importance at this time.
Well, let me reset the table here and reintroduce our guests. We have with us here in the studio Kristine Voos. She's an epidemiology coordinator for the Genesee County Health Department and a public information officer. Also joining us is Mary Hamilton, a public health educator with the Health Department, and Dan Ireland, the president of United Memorial Medical Center. We welcome all of you. It's good to have you here. And we also want to let our listeners know that we are ready and willing to take your questions if you have questions that for whatever reason are not clear to you, that the answers haven't been clear, or if you have more specifically a question that relates locally to this COVID-19 outbreak. You're welcome to call us at 344-1490. You do not have to go on the radio. Our producer will take your question and we'll pose it to our panel. So it's 344-1490. There's so many different directions we can go in at this point, but let's begin with this, Dan. Is UMMC prepared for what's coming?
Well, as this is an evolving situation, we're always reacting to the new information that we have. But to answer in short, we are as prepared as any healthcare organization can be given the situation. You'll see a very different UMMC right now if you come over to the hospital. We are under visitor restrictions. We are asking people who are having signs and symptoms of illness not to visit at all. And for something that's a little different, we always ask people not to do that. But a little different now is we are turning people away at the door. You will see door security at our Bank Street and North Street campuses, screening patients as they come in the door. And Dan, there's an important difference.
What's the screening?
Yeah, I want to make that differentiation because I think people hear screening and they think we're testing, and that is not the case. Testing only happens after a clinical algorithm is done where we decide on symptoms, travel, exposure, and then ruling out other illnesses to determine if we're going to test. Screening is we ask very simple questions. Do you have a cough, sore throat, shortness of breath? Have you been exposed to a COVID-19 patient, or have you had travel?
That's a question you always ask. Have you been out of the country in the last 30 days?
We do, but during this time, and our team at Rochester Regional Health has been monitoring this since December when it came out, and over the time, those questions have been evolving even prior to any of these other measures, asking more of the new locations that were coming out along the way as new areas were identified as risk factors. But today we ask those questions, and as a visitor, if you come to the hospital and you do have an answer to that question, or we detect that you're showing signs and symptoms, we will ask you to leave the hospital. As a patient, we have measures that we will take to make sure you're protected and others are protected, including masking you and getting you to your location and in and out. Again, like everything else, those are going to be very fluid. And as prevalence of the COVID-19 continues to increase, the community can expect that we're going to be more restrictive because our patients in the hospital are the most vulnerable patients, just like our nursing home patients and long-term care are very vulnerable. And we want to make sure that they're protected and safe. And we need to protect the caregivers because we need those folks around to see us through this. But when you ask if we're ready, we have made all the preparations based on the information we have. We have a command team meeting right now all day long. They're working in our command center and they're working with the health system command team. We're leveraging Rochester Regional Health's expertise. They're working with the county health. We talk with the county health department daily, multiple times a day, whether it's with the county health nurses or with the county health director or the epidemiology team. We're in constant conversation, sharing information about what we know and see.
Are tests for coronavirus available on request?
No. That's a very important piece, and we ask people not to come to the hospital or to your doctor's office and say, could you please test me? I want to know if I have it. You have to present with the clinical symptoms, and as I mentioned, there's an algorithm that our physicians go through to determine if they can identify another illness that likely will rank that lower to deciding on testing. Not that we won't test in those cases, but the walking well right now. We're not doing on request. We do have to understand that supplies for testing and the testing availability is just evolving. And so we do need to make sure those tests are available for those that absolutely need that. And so if you call your doctor or you end up at urgent care or hospital and you want to be tested, and if they're told that you're not indicated, that's because our staff is following an algorithm that's currently out and published.
So tests can be conducted at UMMC, or can samples be taken at your family physician's office?
So right now, we're only sampling at the urgent care center and the emergency room when referred to by the primary care physicians, or if the health department calls and asks us to see somebody for any particular reason. Our primary care physicians are not sampling. We have actually a protocol through our health system to route people, and I can't stress this enough, Dan. Call before you come. Call your doctor's office, call your specialist's office, call those folks before you come to any of our facilities so that the doctor can appropriately triage you. One thing Rochester Regional Health rolled out during the middle of this that we were making preparations for was an expanded telehealth capability. And many of our offices now have the capability to see you remotely without you even coming to the facility, which is the best case scenario. And then they can make a decision whether or not testing is needed and refer you appropriately. But and it is sample collection locally. We still send our tests to either Rochester Regional Health Lab in Rochester or through one of the county health labs that are designated to do that. So we do not perform the actual test locally in Batavia.
Kristine, let's ask you, the epidemiologist among us. Are these tests reliable? Do you get false positives on these?
So the tests are reliable. It's great, how Dan said that Rochester Regional Health has just signed on, and I think we'll see increased testing capacity in the coming days and weeks. So it is a reliable test, and that Rochester Regional Health has signed on. We've had the State Department Wadsworth Laboratory that was first approved by the FDA here. Before that, it was to the CDC, so that has changed. Erie County Public Health Lab is another avenue for testing of the specimens. So, yes, it's great to have that option, and in the with the fluid situation, that will be changing as far as how many locations are able to test these specimens.
We invite our listeners to once again call us if you have a question about COVID-19 in Batavia and Genesee County. We're at 344-1490. You do not have to go on the radio, but just give our producer your question, and they will route them into us as we have a question here. And Mary, Public Information Officer, this is a tough one, so we're going to give it to you from a public relations standpoint. But sure. Batavia Downs is so popular here. This caller wants to know about the Downs, those slot machines being so close together. Everyone touches those machines. What should a patron be thinking about should they decide to go over to the Downs and try their luck?
So that is a tough question, but it is a good question. It's a very relevant question because the Batavia Downs does see a lot of patrons, not only from, Genesee County, but, from all different areas. It's a wonderful resource in our community. It's a very fun venue, but certainly with guidance that has come out, the CDC did put out yesterday, not having gatherings over 50 people or more. Whereas, that obviously falls, the Batavia Downs is, a lot of times it's over 50 people, right? So, just being mindful, this is a changing, issue, and it is something that is a burden to our everyday lives. This isn't something that we normally have to deal with and think about, changing our plans and making adjustments so that we are staying as healthy as possible. So
the state of Ohio has decided to shut down bars and restaurants, as I understand it. Are we headed for that?
So New York State does not have any official declaration, but like Kristine, like Dan keeps saying, we are in a very fluid situation and things are evolving and changing rapidly. So please don't be surprised if that's something that you do see in the near future.
Some other questions that we received prior to going on the air. Can you infect others if you are asymptomatic or have no symptoms? In other words, let's assume for a moment that you have the COVID-19 virus but are not yet symptomatic. Can you spread the virus?
They are saying right now that when it comes to that question, that when someone is experiencing those symptoms is when that transmission is occurring. Again, this is a novel coronavirus.
What does that mean?
New.
Okay.
Simply put. So that is, not as clear as I guess we would like it to be. So that's why it's important to make sure that you're practicing good hand hygiene, you're sanitizing those high touch areas, and just going back a little bit to what Mary was talking about. Yes, there's no sort of declaration saying that you aren't allowed to go to casinos or other places, but personal responsibility. Right now, social distancing, keeping yourself away from large groups, and just trying to kind of, be cognizant of that is important. Lots of times people just go on with their day, and in this situation, you need to alter your life, and taking that personal responsibility and doing it before it's declared that you have to do it is important and is going to help the situation.
Let me ask all of you this, you're public health professionals. On Friday night, after a long day at work, I went out with my wife and we visited a local establishment, and it was packed.
Yep.
Absolutely packed. Are you disappointed in the response from local establishments as to, we had the guidance from the state, if you have a capacity of X, you're supposed to only set it up for half of that. Are you satisfied that that message is getting through and are local businesses abiding by it?
So I think this is a really great opportunity to, just share the messaging, because maybe people are not fully aware of what is going on. And that is okay, because this is we can't stress it enough, a very fluid situation. And so maybe business owners are just not aware of what is going on. I know it's, difficult to think that, but it's possible. So just making sure that we're sharing the message, and just practicing social distancing. And like we keep saying as well, this isn't normal life. We want to take precautions. We want to protect our elderly. We want to protect our immunosuppressed, individuals. We want to make sure that we are not, we may be 30 some odd years old and we're very healthy, but we want to protect our community.
Well, some of us, Mary, are nowhere near 30.
Dan,
long way from it.
I have to agree with Mary. I think with the messaging coming out so fast and furiously, I do believe that people are struggling to respond to it and understand what to do. So I would say, I don't know that I want to say disappointment is the feeling, but I agree it's important for us to keep repeating the message, keep providing guidance, and if people are confused by it, we ask people, ask questions. That's why we tell our patients, call us. Don't just assume you have, if you're not sure, call. We'll give you the guidance that we have. But it's important that we keep reiterating, we will watch this evolve, and we have watched it evolve even in over the weekend. There's different locations I went into, even stores and whatnot, where you see things have, changed from what the normal operations are. So I think we have to be diligent about saying it over and over again, and people will respond accordingly. But it's social responsibility and personal responsibility is a key thing. Yeah. Each of us as an individual has a responsibility to take care of our situation as well. So if a local venue hasn't taken the steps necessary, we can still take the steps necessary by social distancing, by understanding what that term means, as you asked us to define it earlier. But also, again, if we're not sure, ask questions, which it looks like you may have more.
Yeah, well, we do. These are being called in, and if you would like to ask a question of our esteemed panel, you are welcome to do so at 344-1490. You do not have to go on the radio, although you're welcome to, but our producers will take your questions. And here's another one of them. How is COVID-19 actually transmitted?
So COVID-19 is transmitted.
Is there a COVID-18? No, I'm serious. I mean, where do they come? How do they name these things?
They named it COVID. You've got CO for coronavirus, the COV, coronavirus, infectious, the I, and then D standing for disease. And it was identified in December of 2019. So you package it up and there's COVID-19.
Well, I did not know that. See, you learn things all the time. But how is it transmitted?
So it's a respiratory disease. So the droplets that a person expels through coughing, through sneezing, things of that nature, practicing good etiquette when you're coughing in the corner of your elbow or into a Kleenex is appropriate. Also, if that person who is sick is touching different areas, that is another way that it could be transmitted. They're saying that it's most infectious when you're in close contact with it between 6 to 8 feet from a person who's experiencing symptoms.
How long can a virus, or the virus that we're talking about, live on a surface? Do we know?
That, I think, is not as clear as we'd like it to be. I think at this point they're saying several days. Dan, I don't know if you have any.
Yeah, the latest update I had heard, but again, it's so fluid, and depending on what source you go to, but I was hearing 72 hours was something people were saying. But again, that's I could say that right now, and 5 minutes from now, a new publication will come out. Remember, this was identified in December. This is an incredibly short time period for the healthcare experts to identify and continue to understand how it's actually evolving and what's happening. So my suggestion is, and exactly what you were saying is, assume that it can live on a surface. Just assume it can live on a surface and wipe those surfaces down. The other point I truly want to make to people too, because I know there's been rushes on all kinds of things at the store, including hand sanitizer, and I think we've become very accustomed to using hand sanitizer but soap and water is effective. So please wash your hands. If you can't find hand sanitizer, find a sink and soap and water and wash your hands. And that's one of the biggest areas we can stop the spread. And as we were mentioning, don't touch your face. If you haven't washed your hands, think of all the areas things get into your body, and just think about ways you can stop that from happening and take those precaution measures. But until final guidance, and I think it'll be months and maybe longer before the experts can really determine how this bug works and how long it stays out on surface. You have to assume it does live on the surface and wipe those surfaces down.
Before our guests came in this morning, we were able to secure a supply of disinfectant wipes. We have kept them under armed guard since that time, and we wiped down the studio. And being in a room where disc jockeys perform 24 hours a day, believe me, COVID-19 is the least of our worries. But anyway, that was supposed to be a joke, guys. You can laugh at it. Another question from a caller. Are there any special recommendations on washing clothes, temperatures, or types of soaps that should be used? Is that a concern?
Regular, keep on doing what you're doing as far as washing your clothes. I don't. Going to the store and making sure you have your regular laundry detergent.
Nothing special needs to be done there.
No.
What is the relationship between this virus and temperatures, ambient temperatures? I've heard some discussion about this, that, when the peak of the summer hits, that this virus may be taken care of for us. Is there any proof that temperatures are a factor?
So when it comes, it is, similar to kind of like the flu. So we have our flu season, and then once it warms up, it kind of dies out, and we get out of
Is that a lifestyle? Well, no, because more people would be out at night. But there is a relationship between the lifespan of this virus and the temperature that it's in.
I think we're hoping so that once it warms up, that we'll see decreased amount of cases, again, to be determined.
What are the defining symptoms? We've got people at home who are sniffling or maybe sneezing and perhaps running a low-grade fever. Is there a defining symptom that tells you, yep, quite likely coronavirus? Who wants to take that one?
From the healthcare screening standpoint in the hospital, I don't think there's a single defining symptom. What we've defined the three that we talk about: the cough, shortness of breath.
But that could be, I guess my point is that could be other things.
It could be other things. So that's where it requires a medical professional to help evaluate. Those type of those fever, cough, shortness of breath. You're right, could be any number of things. But that's where a medical professional has to ask other questions, including exposures, and also trying, as we talked about before, trying to rule out other things that could be the cause for that situation. So I think my answer to that is there's not one symptom, that's not one special thing. Where other diseases there are, you see a certain type of rash, or you see a certain type of, it's a combination of symptoms and then it's clinical judgment. And that's why we ask you to call your physician. Call your physician. I can't say it enough. They can often hear your history on the phone and give you good direction, and maybe prevent you from exposing others or you getting exposed if your immune system's worn down by some other illness to others out there that might be carrying it.
Let's go to Mary Hamilton, public health educator. Mary, another caller from a listener. I am a diabetic and I have a scheduled blood draw on Friday. Should I be concerned?
So like we keep saying, call the lab, call, the provider where you're going, and just making sure that that's still scheduled. I'm sure that, especially being a diabetic, they're a special population and we want to make sure that we're taking care of them. So just giving a call ahead, just making sure that everything's scheduled. They may ask if you're exhibiting symptoms. So just answering questions that your provider asks you.
And again, I think all of you have touched on this. The preferred method for seeking out information from your personal physician is to call first.
Absolutely.
Okay. We're going to take a quick break here and give our guests a chance to catch their own breaths, and we'll be back with more of this special edition of Main and Center on WBTA. We've received several questions, and we'll get to all of them. And if you have a question that you would like to ask, 344-1490. We'll be right back. My name is Dan Fischer, and I'm joined in the studio today by Kristine Voos. She is an epidemiology coordinator for the Genesee Orleans County Health Department's Mary Hamilton, who is a public health educator with the Health Department, and Dan Ireland, president of United Memorial Medical Center. One thing we were talking about during the break is really the wealth of information that's out there. What would you recommend as being some of the better sources of information? I'm going to assume it's the UMMC website and the Genesee Orleans County Health Departments, but I know that the Health Department has right on your home page is a pretty good listing of questions and answers.
Yeah, we're very proud, and we maintain our websites regularly. We're a traditional 9-to-5 organization, but this warrants us to be very flexible, and so we are updating our information on weekends. We're updating them on evenings. We want to be very clear with our community. We want to get the message out. We want to get the information out. So our websites, the Genesee and Orleans County websites, are up to date with a lot of great information. We are also very active on social media. We have a Facebook account, Instagram, Twitter. Go Health NY is our handle, or you can search that. That'll bring you right to our pages. We have a lot of really great resources available. Certainly a lot of information from the New York State Department of Health. the Centers for Disease Control and Prevention, the CDC. Those are two really fantastic, reliable sources where you want to look first for your information. You know, there's a lot of hearsay on social media, and you just want to make sure that you're reading reliable sources.
I'd like to underscore that as well, because there's so much misinformation or disinformation on social media. Just because you've read something on Twitter or Facebook doesn't necessarily mean it's true. Look for the source of that information.
Yep.
Have you detected locally a panic?
Well, I think we've noticed from people's reactions, and we were discussing on the break as well, walk into some of the stores and you see the things that are emptied off the shelf and you see the news articles.
What about the toilet paper?
Yeah, right. So, yeah, it's interesting what people are grasping onto, and again, I do think to a certain degree this is making people nervous, and to go back to what we just talked about, the best way to address that is to get the facts. And so if you go to the County Health Department website, Rochester Regional's website, where all of our facts tie back to the CDC's recommendation and information, and any local information related to that, I encourage and implore people, get the facts. Don't rely on rumor. Don't rely on, look up the source, as you just said, and get the facts. And that will help people be calmer and understand that I believe as a community we'll see our way through this. And your health providers throughout the community, doesn't matter what organization they work for, we're all working together. And I was communicating with physicians who aren't Rochester Regional physicians yesterday, answering questions about protocols so that we're all on the same page. And again, as I mentioned earlier, we're in constant contact with the health department. So I think people are worried, and I think we can help with that worry by remembering the facts and working through it.
One of the things you hear about quite often when you're talking about this on the outside, is this really any worse than some of the other epidemics that we've had? I'm thinking of swine flu. I'm thinking of Zika virus or MERS or SARS, or we have these acronyms. Is coronavirus significantly more dangerous than those?
So the data that we're getting from China and South Korea is that 80% of people, will do just fine. Similar to the flu, they can manage themselves at home and, through some comfort care, making sure that they're hydrated and things of that nature. But for 20% of the population, our elderly population, people who have comorbidities like diabetes, hypertension, things where their immune system may not be able to respond to this new COVID-19, they may need to seek care in a hospital.
Now, does that put it in a different category, Kristine? In other words, people do pass from flu.
Yes, yeah. So it's the mortality rate that they're seeing in China and South Korea is around 1%. Now, individuals who are elderly or have comorbidities, they're disproportionately affected. So that's why it's important to, and it's similar to the flu. I think the difference here with COVID is that it may not impact the young children as hard as the flu can, but information, is still coming out, papers and things of that nature. So it's really important for those high-risk individuals to have a plan in place of, how they're going to get their medical care, their medicines, having those plans in place is a great idea if they haven't already done it.
One thing that you've all mentioned at one point or another is dehydration. It seems to be common. What's the best way to ensure that you are keeping yourself hydrated? Is it as simple as drinking water more often?
I think a lot of times it is not just water, but it's also drinking, other type of electrolyte solutions, Gatorades, and other solutions like that are often helpful if you fear you're getting dehydrated or if you're under the weather. We generally tell people, most people with cold, flu type illnesses, you do have to just keep make sure you keep hydrated. And so if all you have is water, drink lots of water. And it's what our mothers all told us when we were young, drink your water. And but also the electrolyte solutions are very helpful too, in helping replenish that and get you back to normal from
Are
that.
treatments for coronavirus, for those who have it and have exhibited symptoms, is it just, how did you put it, comfort measures? Is there a cure for this? Is there anything that one can take in terms of medicine that kills this virus?
So as of right now, there is not a drug that you would take for the coronavirus, nor is there a vaccine for the coronavirus. The promise of the healthcare community is anytime a novel strain is developed, there's research being done immediately to try and come up with something. But you hit the nail on the head. It's supportive medications for the symptoms that you're feeling. So in this case, a lot of times it's decongestants and cough suppressants and things to help you get through the worst of it. And as was mentioned, the 80% of most people don't even need to be hospitalized. They're gonna weather the illness and come out on the other end fine. But as with any population in any illness, if you have other medical conditions, you have to be acutely aware of that situation and be talking with your doctor about what that is. But no magic pill yet for it. So and I think at this point our providers are treating people accordingly.
As well as a vaccine that would prevent this is not available either.
It is not as of this time that I'm aware of.
Is a regular flu shot been shown to be slow this down or have any impact? Do we know?
I don't know if our
Yeah, I think that's kind of an unknown. In the beginning, the messaging was make sure that you have your flu shot to kind of protect you from, again, getting the flu, a much more common respiratory infection out there, given this time of year. So.
Yeah, and I will tell you, at the hospital, we pushed very hard to have our staff get the flu vaccine for two reasons, because as you may recall, in the flu season, staff members who aren't flu vaccinated have to wear a mask all the time. So if they're vaccinated, those masks can be preserved for the other protections we need to give for coronavirus patients. So I will say United Memorial has been very successful with over 96% of our staff members are vaccinated for the flu, and many who aren't because of medical reasons and cannot be. So we have quite a response from our team to ensure that we are using the flu vaccine as our ability to protect our patients.
Mary Hamilton, what about these masks? We hear a lot about that too, that they may not do you any good at all, or certain types of masks.
Sure. So masks are definitely a hot topic right now. And, we are not encouraging, we are telling people they do not need to wear a mask if they are well, if they are on the street. It's reassuring that, just from what I've seen in Genesee County so far, I have not come into, when I'm out in the store or out in public, I do not see people wearing masks. And that is what we want. We do not want to see people wearing masks who are healthy. We want to save those masks for people who are sick, and healthcare workers especially. And there's a lot of different masks, advertised on the sidebar of just regular websites, and they're not going to give you any protection. So there are specific masks that will protect you, but normal, healthy people do not need masks.
What is magical about 14 days with this virus?
So right now they're saying that is kind of the length of time that it would, the incubation period, where...
What's that mean?
That means that a period where you will develop those symptoms. Anywhere from 2 to 14 days is common. If someone was to test positive for COVID-19, they would get put into a mandatory isolation for those 14 days. And then there's also protocol for once that 14 days has expired that they be tested, and they have to be tested in a certain way, and they have to test negative a certain amount of times before they would be taken out of that mandatory isolation. And that's for a COVID positive person. So there is structure in place and guidance in place on how to correctly take a person out of that mandatory isolation once they have resolved from COVID-19 and making sure that they're testing negative before they're removed from that.
We need to take one more break, and we'll begin to wrap things up with our guests here on Main and Center on WBTA.
Here at Batavia's Original Pizzeria.
At WBTAI.com. Dan, I'd like to go back to you as we begin to wrap things up, and we did touch on this earlier about the preparation for the local healthcare community. Do we have the resources here should, or maybe we should say when, the COVID virus is detected in Genesee County? If we look at these numbers, we're talking generally about 20% of those who contract this virus will need some type of medical intervention. Are you prepared?
We are. Our team has been working diligently since the beginning of this, and certainly more aggressively in the last 2 weeks. We have not only as part of our regular planning what we call surge plans. So in the event that we receive more patients than we normally do, we have a certain amount that we can expand to, and then we have an amount that we can go above that. So
do you foresee setting up tents in the parking lot?
Well, the discussion has come about that. So if you see tents in the parking lot, they're going to most likely be to help triage large volumes of people who might be coming into the hospital. I think right now we're hearing it about mostly worried well that are still showing up and not calling and getting guidance. So if you do see one, it's because of something like that. I'm believing we won't see tents for treatment or for you might see in some other areas. We do have a number of areas in our hospital that we have the ability to expand care to. The key is going to be continuing to make sure that the resources are available to us, such as masks and supplies and cleaning agents and whatnot. And then the other key will be marshaling the nursing and provider resources for an expanded volume of patient. All of that planning is underway right now throughout Rochester Regional Health, and we're relying on each other to help, as well as our other partners in the community. And yes, the answer is we will plan and prepare to take care of the patients that will need our care, the care locally for us, and continue to work with our partners to get the resources we need to do that.
A couple of more phoned-in questions. We'll try to get to these quickly. Should you attend wedding showers or weddings or showers or other family events? What's your guidance on that?
So like we keep saying, this is a burden to everyday life, and we want to make sure that we're protecting our elderly, our immunosuppressed patients. So, a lot of times you're going to have your grandparents at these important events, and you want to make sure that even though you feel fine and you may be able to recover from this just fine, that they may not. So you want to make sure that you're protecting those individuals. I would say it's on a base-by-base basis, and I know it's an unfortunate event to cancel something so special, but postponing it is not going to be the worst thing that happens, and it's your responsibility to protect your family, especially your family and your community. So, it may be a burden, but postponing those events may be in your best interest right now.
What about pets? The specific question was, are therapy dogs allowed into nursing homes these days? But let's broaden that question out a little bit. Do we have any evidence that pets can transmit this virus? Do we know?
So I had, looked into that because I'm hearing about people love their pets sometimes more than other people. And they have done some testing in Hong Kong on some animals, but it's still an unknown. The 2 animals that they had tested showed a weak version of the virus in the nasal passage, but wasn't able to distinguish if it's infectious or not. So at this time, just don't be overly concerned about that. Making sure that you have enough dog food on hand or cat food on hand, litter, things of that nature would be helpful. But again, not hoarding those items. Federal and state officials have been saying that the grocery stores will stay open. Right now, they're trying to stock those shelves back up because people are hoarding, and that is discouraged. And So as far as keeping some extra food on hand, that's helpful, but having enough for Fido for the whole year, not necessary at all.
With some of our pets, it's hard to keep a social distance. Another question are the satellite offices of the hospital, I'm thinking urgent care and doctor's offices, open if you have a previously scheduled appointment?
Yes, but we ask that you call ahead for your for all of your appointments. Our offices will, first of all, screen you.
Now, even if you have an appointment set?
Yes, we would ask that you reach out and call ahead so that way we can, one, screen you over the phone and help guide you in case you need some guidance related to that, and we'll just make sure that we're prepared to take care of you in the event that you are exhibiting some symptoms of concern. Dan, the one other thing I failed to mention, and it sparked my thought when we talked about canceling venues and whatnot. Today, one of the measures the hospital did take to help flatten the curve is we have postponed elective surgical procedures for all patients for the next 2 weeks. There will still be patients getting surgery if the doctor feels that there is a clinical reason that can't wait, but we will be postponing, effective today, all elective surgical procedures at the hospital. And this is really aimed at flattening that curve, making sure that we keep patients who don't need to be accessing the healthcare environment home and not out in the community. And as you can imagine, any surgical procedure in itself causes a biological response that impacts immunity, and so if we can avoid introducing that, we will. Please call your specialist or surgeon's office, and they'll be reaching out to you as well to make sure that plans are made for when that'll be rescheduled and to understand that. But you may see some more of those things, similar things related to office visits and things like that happening as this continues to evolve.
This postponement of elective surgeries, do you have a time frame on that, or is that until further notice? Or?
Right now, it was up until March 29th, and then with the idea that we could reassess that based on the conditions and what's going on. So we started with a 2-week window, and then we felt that after that we would assess it as it's happening. And this is largely based on recommendations from the American College of Surgeons and nationally recommending areas that are receiving COVID activity to take these measures.
Well, our time has gone by very quickly. In fact, we're running a little over, and at this point I have to say that you're listening to WBTA, Batavia, New York. And Mary Hamilton, what can we tell our listeners in terms of seeking out additional information? What are you recommending?
Yeah. So we have a lot of really great resources. Like I already mentioned, our websites, CDC, New York State Department of Health, social media pages. But folks can also call, our state number. There's a New York State Department of Health hotline that was set up specifically for coronavirus questions that anyone in the general public can call into. That hotline number is 1-888-364-3065. Again, that's 1-888-364-3065.
And a live person will answer?
Yep, you got it. Live person will answer.
And it probably
talk.
doesn't spell anything. I would have thought 888-COVID-19.
No, we try to keep it simple. Yeah.
1-888-364-3065. And that is a statewide number. You'll get a live person on the phone. We can do this again. I hope it won't be necessary, but it might be. And I want to thank all of you for coming in today. Kristine Voos, epidemiology coordinator with the Genesee Orleans County Health Department's Mary Hamilton, public health educator, and Dan Ireland, the president of UMMC. These folks have been extremely busy over the last couple of weeks, and to find time to spend with us on the radio, we really appreciate it. So thanks so much for coming in, and we'll keep you posted right here on WBTA.
News, I'm Alex Feig. Our top story, Glow County schools closed for state of emergency.